this is RN Shweta and welcome you all once again to my channel Nursing with RN Shweta. In the previous video, in part 1, I have explained everything about the fluids and electrolytes, the basic terminologies, the processes that we need to know, and also we discussed the types of IV fluids along with its examples. In this video, as a continuation of the part 1, part 2, we are going to study about fluid volume deficit, or very commonly known as dehydration. Yes, we are going to study the goals, the cause and also the nursing interventions of fluid volume deficit or dehydration. Also, like always, I have explained the same content in 2 more languages, that is Hindi and Nepali. If you are familiar with those languages, please do visit my channel and you'll find the videos there. Also, please don't forget to like, share and subscribe so that you don't miss out on the important topics for your exams. Fluid volume deficit. What does it mean? It simply means that your body is lacking fluids. Now, what may be the cause of it? The main basic cause of fluid volume deficit is you are unable to provide the minimum amount of fluid that your body requires. So the best explanation for this would be, you might have heard about demand and supply chain. If the demand is more but the supply is less, there will be an imbalance in that chain. Similarly, your body requires certain amount of fluid to maintain the balance in your body, but you are unable to supply or to provide that particular amount of fluid. In that case, the fluid volume deficit or dehydration occurs. But the investigation, of course, doesn't end there. You need to rule out the cause as to why your body is unable to supply the particular amount of fluid to your body. Maybe because the person is continuously vomiting, the fluids has been wasted too much, or maybe the person is continuously on diarrhea, episodes of diarrhea, or maybe the person is not eating by mouth anything for a certain number of days. So these all may be the causes of fluid volume deficit or dehydration. So now, after knowing the cause, we need to move towards the goal of the treatment. What are the basic goals of the treatment? The number one goal is to restore the fluid volume. How much ever has to be restored, you need to find out, calculate and then restore the amount of fluid. Number 2 is you need to balance the electrolyte. Like the bill comes with GST, fluid imbalance comes with electrolyte imbalance. They are like two best friends that come together along with. Okay, so once the fluid volume is imbalanced, the electrolyte also tends to imbalance. So the second goal of treatment is to balance the electrolyte imbalances. Okay, and the third one is whatever cause you have ruled out for the dehydration or fluid volume deficit, maybe vomiting, maybe diarrhea, maybe no fluid intake or whatsoever, you need to treat that particular cause so that the dehydration does not continues. Moving on to the types of dehydration. So there are basically 3 types of dehydration. They are isotonic, hypotonic and hypertonic dehydration. So what is isotonic dehydration now? Isotonic dehydration is the most common type of dehydration that occurs, in which the amount of electrolyte and water is lost in equal proportion. It's not that more of electrolyte than water is lost, or more water, less electrolytes is lost, nothing like that. Both are lost in equal proportion, and this is very commonly known as hypovolemia. Okay, so what happens in this isotonic dehydration is that the circulatory volume of your body decreases, which results in inadequate tissue perfusion. Your tissue doesn't get enough perfusion. The second type of dehydration is hypovolemic dehydration. So in hypovolemic dehydration, more amount of electrolytes are lost and lesser amount of water is lost. In this, what happens is the fluids from the plasma and interstitial spaces tends to move towards the cell. Okay, it moves inside the cell. So now, because of the fluid shift from plasma to the cell tends to get swelled up and the plasma volume tends to reduce. Plasma volume deficit occurs. This is hypotonic dehydration. The third type of dehydration is hypertonic dehydration. It is just opposite to the hypotonic dehydration. What happens in hypertonic dehydration is that the more amount of water is lost and the lesser amount of electrolytes is lost. The fluid shift occurs opposite to that of hypovolemic. The fluid shift occurs from intracellular spaces towards the plasma. Okay, so when the fluid starts moving from cells to the plasma, what happens to the cells is the cellular dehydration occurs and the cells tend to shrink. I hope you understand what is shrink. Yes, the cells tend to shrink and the cellular dehydration occurs. We've now reached to the management part. So let us first discuss what may be the nursing management. Nursing management always starts with goal. What may be the nursing management goal? So the first goal may be to prevent the further loss of the fluid, because the person has lost enough amount of fluid so that the person is already into dehydration. You need to take measures so that you can prevent the further loss of the fluid. Yes, and the second goal may be to increase the amount of fluid in the patient's body so that the fluid reaches the normal ranges. Okay, moving on to the intervention. So always the intervention starts with monitoring and observing. Okay, the first thing you need to monitor is the signs of dehydration in the patient. You need to monitor the intake and output charts of the patient. Yes, you need to monitor whether the patient is having any electrolyte imbalances, and if yes, which electrolyte has been imbalanced. Okay, you need to take a note of it. If the patient is able to take fluids orally, you can also provide with oral rehydration therapy. You are very aware about ORT. Yes, and also whatever the medications that have been prescribed by the physicians in order to treat the main cause of dehydration, like the physician may have prescribed antidiarrheal for diarrhea patient, antiemetic for vomiting patient, or maybe antipyretic for the patient who is having fever. So these medications, prescribed medication, you need to administer. And at last, when it comes to the treatment of the fluid by solutions, IV infusions, the theory is like if the patient is having isotonic dehydration, you need to give isotonic fluid. If the patient is having hypotonic dehydration, you need to give hypertonic fluid. And if the patient is having hypertonic dehydration, you need to administer hypotonic fluid. These are the main theory how fluids can be administered, but you should always consult your physician first before administering the fluid. Summary time. So in this video, part 2 of fluids and electrolytes, we studied fluid volume deficit or dehydration. In this video, at first we studied what are the causes of fluid volume deficit or dehydration. Yes, the supply is lesser of the fluid than what the body actually needs. The next thing we studied was the goal of treatment, that is to normalize the amount of fluid in your body, also to correct the imbalances of the electrolytes in your body, and to rule out the cause of the dehydration and eliminate it. Yes, so next thing we studied was types of dehydration. The main three types: isotonic, hypotonic and hypertonic dehydration. Then reached to the management section, yes, where we discussed the nursing management of patient with fluid volume deficit. We discussed what may be the nursing goal of the fluid volume deficit. Then we discussed some of the interventions, nursing interventions that we may practice for the patient of dehydration. Yes, we also studied the treatment of types of dehydration with the types of IV fluids that we have. For isotonic, giving isotonic solution; for hypertonic, giving hypertonic solution; and the hypertonic dehydration, giving hypotonic solutions. So with this, we came to the end of fluid volume deficit or dehydration. If you have any questions or queries about the topic that we discussed today, you may write your questions in the comment section below. I'll surely get back to it. Also, if you want any part of this video of the topic to be explained more clearly, I would love to do that. Please comment it in the comment section below. Also, please do like, share and subscribe my channel so that you don't miss out on any important topics for your nursing exams. Thank you for watching. Bye bye.